Hello, my colleagues. A very warm welcome. Today we're going to discuss about labor ward module, shoulder dystocia. The mnemonic super at helps us remember the steps involved in managing shoulder dystocia. First, shout out for help. Call the senior most obstetrician, anesthetist, and neonatal team immediately. Ask the mother to stop pushing and avoid any fundal pressure. Second, up with the legs, which is the McRoberts maneuver. It involves flexion and abduction of the maternal hips. It approximately has 90% success rate. And remember, the traction should always be given in axial direction. Third, pressure suprapubic. You apply suprapubic pressure from the side of the fetal back, and the pressure is applied from the posterior aspect of the anterior shoulder of the fetus towards the chest. This is done by an assistant whilst you continue to perform McRoberts maneuver. And always remember, never give any fundal pressure. Fourth, enter maneuvers, which means internal rotational maneuver. You might want to consider episiotomy at that time. Fifth, remove the posterior arm of the fetus. This reduces the bisacromial diameter to facilitate delivery of the fetus. Sixth, all four position. This approximately has 83% success rate, failing which you could either repeat all the maneuvers or you can move on to the third line maneuver, which is very rarely used, Zavanelli maneuver, which means positioning the fetal head back into the vagina, followed by cesarean section to deliver the fetus, or the cleidotomy or symphysiotomy. Let's practice some questions relating to shoulder dystocia management. First question. When managing shoulder dystocia, the McRoberts maneuver has approximately what success rate? It has 90% success rate in resolving shoulder dystocia. So option D is the correct answer. The next question. We've got a primary gravida who has reached full dilatation and she begins pushing. During crowning, the midwife notices that after each push, the fetal head retracts tightly against the perineum, a classic turtleneck sign. What is the most appropriate immediate action? Moving on to the options. Option A, apply suprapubic pressure. That's incorrect because that wouldn't be the immediate next action. It follows if McRoberts maneuver failed to relieve the shoulder dystocia. Option B, perform delivery of the posterior arm, which is an internal maneuver, and again, this follows after the first line interventions have failed. Option C, attempt internal rotational maneuver. Again, this is an incorrect option for the same reason explained previously. Option D, move the women onto all fours. We would want her to move into all fours after all the internal rotation maneuver has failed. Option E, perform the McRoberts maneuver, which is the correct option. This is the first line intervention for a suspected shoulder dystocia. Thank you for your time and have a good day.